listen.
I decided together with the Minister of Health to appoint Professor Roni Gamzu to be the project manager of the Corona. Professor Gamzu has great experience in the health system. He was a Director General of the Ministry of Health. During the first wave of Corona, he established very successfly the project to protect the elderly. And I want to remind you the exciting thing, Roni, that was published on a TV program. You had to cope with cancer in the last few years. You did not give up to the difficulties. You prevailed over cancer, so you will help us to prevail over Corona. I would like to thank Professor Barabash for his important insights, which assist us to struggle against the Corona. We will continue to be assisted by his good advice. Professor Gamzu has one great mission: to stop the chain of infections. And for that, you will get all the authority, and I want to reiterate, all the authorities in 3 areas: tests, investigations, quarantines. Professor Gamzu is going to manage the whole system of tests to detect Corona in all the labs all over the country. He's going to manage the epidemiological investigations in order to detect who the carriers and the sick people were in touch. He will also manage the whole system of quarantines of the cases who were detected in order to stop the chain. I want to say that the IDF has a very great part in this activity. And according to the policy of Professor Gamzu, we will make a decision in the government regarding closures and lockdowns. I want to tell you that many countries that opened the whole economy during the first wave are suffering now in the second wave because of the morbidity. And I told you that it's going to happen. I spoke this morning with my friend, the Scott Morrison of Australia, the Prime Minister. He told me about the partial closure that they have now in Australia and the other countries, Texas, California, Florida, Arizona, and others. We are still trying as much as possible to avoid total lockdown. But if need be, we will do it, because what leads us is saving lives. And this is the supreme consideration. Together with Professor Gamzu, we're going to make the right decisions based on updated data as much as possible and medical and economical considerations, meaning we're not going to be populist. There's no such thing. The easiest thing in the world is to be a populist. Open, why not? Do it. Make things easier. In the meantime, the morbidity rises. It's very easy to be a populist, but we're going to make decisions based on professional consideration of maintaining health and saving lives. And of course, looking after our economy as well. After we flatten the curve and reduce the number of cases, we're going to implement the strategy of Professor Gamzu. We're going to do everything possible in order to open the economy, the education system, and other areas. And we will be able to be safe, to live for a long term. Long term means until we find the vaccination against the virus. I hear, of course I do, the criticism of people who are sitting in the dress circle, those who have no responsibility whatsoever. And they also speak with non-responsibility. And I want to tell you, citizens of Israel, I am on the court. The football court, and we see everything that's happening. I hear politicians and I hear journalists who are very easy on the keyboard, but we are in the ball court and we work 24/7. But it's battlefield, and we are in a global battlefield against the virus. It's a pandemic that we haven't seen for the last century. In wartime, there's no time to respond to any futile claim. The caretaker government at the beginning, we could act very quickly because we had emergency rules. But now we have a fixed government and we don't have this possibility. And that's why we did three main things. First of all, we enacted the extended Corona bill, which authorizes the government, or the cabinet actually, the cabinet of Corona, to do things quickly for the benefit of the public. I voted for this bill last night at midnight, and I want to thank MK Asher and the Deputy Minister Kish for their very hard work to pass this bill. Also, Benny Gantz and I decided to reduce the Corona cabinet by half in order to accelerate the process. And the third thing, as you see, we are appointing today the national project manager. And this way we'll be able to make decisions much quicker. And also they will be more fixed, because you make a decision, you know, in the former time, you had to pass it in the Corona cabinet, then to pass it to the government, then to the legal advisors. And this is a situation that you make a decision, then people don't like it and they negate it. It's less popular, but it's very bad for the fight against Corona. So we had to pass these decisions, and I'm happy that we did. Another thing we did this week, we added 2,000 positions of nurses, more doctors. We increased the salary of the doctors and the nurses and the social workers, and I thank them to be in the forefront. And I also want to thank the Minister of Finance and all the others who came to agreements. In the beginning of the week, we'll bring to the government the grant program for every citizen, and then it will be legislated in the Knesset so that the money gets to you as fast as possible through the national security. And these grants are added to other economic plans that we have, and we decided upon them before that, for the self-employed and the job seekers. And I tell you already, we're going to have more plans in order to accelerate even more the wheels of the economy and the employment. Citizens of Israel, so that we will be able to struggle successfully against the corona, I want to reiterate, do not underestimate the instructions. Wear a mask, keep a distance, wash your hands, avoid crowded areas. And I'm saying it also to the people participating in demonstrations of any side, those who support the government and those who are against it. Keep the rules, keep the instructions, keep your health. And another thing, why don't you pay respect to our state? Don't condemn and contempt the signs of this country. Don't drag this country to anarchy, to violence, to go against assets and terrible sanitary things of doing things in all the courts. Don't attack the policemen. They do their job. And in this opportunity, I'd like to say a good word to the policemen who are looking after all of us. Thank you. Thank you very much. We all have to struggle with the corona together, with personal responsibility, looking for each other. One man takes care of another. In our sources, it says, now at this month, people are not happy, and I hope that at the rest of this month, we're going to see more good news and more happiness. Thank you. Thank you very much. Thank you, Prime Minister. Now we'll hear the Minister of Health. Good evening, Prime Minister, citizens of Israel. Today, we are taking a further step in our joint struggle against the coronavirus. I'm talking about two processes. One, in the area of obtaining vaccines. I'm very happy to announce that we signed today with an additional American company which is advancing to look for a vaccine, and in these very days it starts phase 1, namely trials in humans. The second process, I would call it The secret is in the people. It started a few weeks ago with the arrival of Professor Chezi Levi to be the Director General of the Ministry of Health. And today, I'm very happy that this process is continuing. And joining us is one of the senior doctors in Israel, Professor Ronnie Gamzu, to the position of National Project Manager of the struggle against the coronavirus. Together, they will be a winning team. It's true, the process was long, maybe too long, but you have to admit that the appointment of Professor Gamzu was very quick. Professor Gamzu is the right man in the right place. One of the most experienced and professional manager, also an innovative person in the Israeli health system. He was Director General of the Ministry of Health and of the Ichilov Hospital. Professor Gamzu will lead, as we just heard, he will lead the struggle against the coronavirus. He will act in the various areas that are connected to this struggle. He came to work, and we are going to stand shoulder to shoulder with him and will give him all the assistance possible. Anybody who is going to look for struggling, for ego problems, conflicts, will find nothing. We all have one goal: to prevail over the coronavirus. And in order to do that, we shall act together in full force. Only determined and quick activities will help us to prevail over the virus. I thank you wholeheartedly, Ronnie, Professor Gamzu, for your agreement to take upon yourself this very difficult mission, and we are all with you. Your success is our success. This week, I visited 4 different hospitals. Obviously, in every place, I went to see the corona ward. In the first 3 hospitals, I saw it as is accepted. Also in Ichilov, I saw it through the monitors. But today I decided to do something else. I decided to feel, to sense what is the experience of the staff members who are working there. And so in the Shamir Medical Center, they attired me with all the defense attire, with all the instructions, leading by the chief nurse. I went into the ward, I spoke to the sick people who are struggling not just for their health, but many times over their life. And I came out of there also by the guidance of the nurse. I was sweating. I took off those clothes, those defensive clothes, and I said to myself, experience? This is what the staff is going through many times a day. The doctors, the nurses, the assistants, the conditions are unbearable. We are able to help them. We are able to assist them. If only we will act responsibly and will stick to the instructions to help these wonderful people to go back to the difficult routine as it is of the life of physicians, of nurses in Israel and all the others who are in the medical system in this country. Let's do it. I wish success to all of us. Thank you. And now the National Project Manager, Ronnie Gamzu.
All right, now we're going to hear from Ronnie Gamzu, the new National Project Manager for Coronavirus. Let's take a listen.
The Health Minister, the Director General, the citizens. Yes, I responded to the request to be the manager of the Corona and to give assistance to the ministry. I think this is the minute that we, the professionals in the medical field, are responding and taking the lead. We don't ask questions. We're coming here in order to do what we have to do in a crisis or a challenge which is very complex. Truth be told, everybody has to do that. The government, the politicians, without struggles, the Knesset, all the authorities, everybody. This is our role. This is our role within the medical system, but you know, it's also the mission of each citizen, because this flag, this country is important to us. And we should and we must and we can together succeed. There's no way that we will not succeed. This is a huge mission. We should all unite. There's a very high morbidity with community infections, which creates really a difficulty in the society, in the economy, and the huge mission is to do it with as less harm as possible in the society, in the economy. A lockdown is very easy. Some countries are doing it. Yes, Australia and Catalonia, they see a rise in the cases and immediately they close this country. But the government of Israel, I must say, with a lot of respect to the government, is trying to do it with social sensitivity without a lockdown. It's not the first thing they decided. On such morbidity, many of the countries decide to lock down, but we, the State of Israel, we try to do it. Maybe we're the first country in the world without a lockdown. We're trying, and we want to do it in this way. It's very complex, very complicated, really. All due respect to anybody who participates, and one way to the public. Look, don't be confused. You walk in the streets, maybe the masks is a bit different, maybe alcohol gel here and there, it's different, but within the hospitals, there are hundreds of cases, difficult cases, and they are there and they go in and they treat the patients and they live up to the challenge and they're doing the best possible medical job in the world. Not just the hospitals, but also the HMOs. A lot of cases in the community are detected and are treated by the HMOs. It's quite amazing. This is an amazing system that does the job. But they also have a threshold. At a certain point, it can also get to the limit. And therefore, we must work. We must pull up our sleeves and do the work. The Prime Minister said, first of all, the trust of the public, to trusting you and in me, but also the whole health system, the whole leadership of the medical field. I bring with me 20 years of medical management. I'm a doctor. I dealt with the polio pandemic. I know what to do. Everything I say is complete truth. It's not exaggerated and it's not underestimated. First of all, we're here and we have to receive your trust. These are one of the huge missions that we have. The other thing is to break the chain from the symptoms to the test, from the test to the investigation, from investigation to quarantine. And in order to cut it and to do it well, we have to work quickly, not to do just tests in the air. We have to direct them to shorten the time to do the right investigation. And I ask you, the citizens, please make sure when you quarantine, do it. Defend yourself, protect yourself, and especially when it's needed. Cutting and the chain is my mission, our mission, but it's also yours. It's also a mission of all of us. How do we prevent and reduce infections? Because my goal is 1-on-1, 1-2, 1-2-5. We have to reduce it to less than 1. This is a mission that we have to do together. The Ministry of Health, the Corona, the government, the Knesset. It's not a mission of Ronnie Gamzu or just mine. It's all of you together, of the Knesset and the local authorities, all the enforcement authorities. Together we can do it. Because we, as a state, we know how to face challenges, and we do. This is a difficult work, but especially because we have a time window which is rather short. but a lot of work. And therefore, it's a combination of the force of everybody, the government, the Ministry of Health, we, the local authorities, the citizens, the entire technology that we have. And at the end of the day, we can do it. We can do it in this short time window. It's short because unless we succeed, then yes, a lockdown, which is, of course, an epidemiological tool. It's difficult because it requires a lot of implications, social, economical, and we try not to get there, but we're going to do everything possible, everything together with you. I am sure it's possible. I trust the citizens of Israel. I'm going to do everything possible for this purpose, and therefore I promise everything. The entire backing. I have all the backing of my friend Chezi Levi and of the minister, the prime minister. I felt it. I felt it. I learned a lot this day, and especially I have the backing that you are giving me, the citizens of the country. And that's the real power in order to prevail over the coronavirus. Thank you. The Director General of the Ministry of Health, Professor Chezi Levi.
Well, we've just heard Professor Ronnie Gamzo speak. He is the new coronavirus czar. Now taking the podium is Chezi Levi. He is the Director General of the Ministry of Health. Let's listen.
Of Israel. It includes a lot of ministries, a lot of people, and we have to implement in the most professional, high level and very quickly. I thank Professor Gamzu, my friend, for his very quick mobilization and the added value of the experience that he brings to us. Together, we're going to serve the Ministry of Health and the citizens of Israel. Together with you, citizens, we will be able to fight together. Maybe we shall prevail, and I'm sure we will, to reduce the morbidity and to do everything that's required. Coping is not just relied on us. I want to thank the health minister, the prime minister, and all the staff of the ministry for standing erect for more than 5 months, and the grappling that we'll have to do in the next few months. And I address you, as the others did, citizens of Israel. Together, we will be able to prevail over this coronavirus. If we do the right thing and do what we have to do, we shall win together. Thank you, and health to everybody. Questions, Mr. Prime Minister. The public looks at this saga, which is continuing for 2 weeks, including appointing Professor Barbash and then cancel it. Isn't this a reflection of the chaos in the way this crisis is handled? And you know, before that, you came to the studio and you promised that you are going to leave your position in time. And are you going to promise to us now, or are you striving towards elections? Another question to Professor Gamzu. Maybe this evening, what is the number that will convince you that there's no other way but to go to a lockdown? First of all, I'm not striving to election. This is absurdity. We are now in the midst of the corona crisis. We have to deal with it, and we have to pass a budget. You can do it in 1 minute or in very short time. All the economists say you have to pass the budget in a short time. It's not me saying it, that you have to allocate it and you have to connect it to all sorts of other political considerations. We have to pass the budget now. This is what we should do. And the only reason that we will go to elections, that's what I said, that they won't pass the budget. We have time till 24th of August. If we have a budget, there are no elections. And the reason that they're not passing the budget, it's because the Blue and White Party, they are not agreeing with that. They connect it to politics. We don't have time. We're going to work now with joint forces. I hope that with a lot of the public, or most of the public, if not all of it, let's act together and do exactly what needs to be done. We have to do one thing. No elections. We have to pass the budget in the next few days. And this way, we're going to pass this crisis. This is one of the important things. It'll serve us. It'll also enable us for the agreement. I was very committed for the replacement of the government. You had another question. What was that? You asked about the process. Look, chaos. I heard about the chaos. Let me tell you something about the chaos. First of all, this process of appointment, okay, legitimate. It takes something so complicated and such important position. It takes time. You talk to people. People have these considerations and others. I'm very happy we made a decision. And the most important thing is you have a person here who agrees to accept the responsibility with cooperation with the health system. And I think he can advance things quickly. So it took some time, but I think that we are now in the right moment. As for the chaos, I want you to understand what the problem is. You make a decision. Now, until we passed the Corona law last night, in the middle of the night, I had to vote for it. Until we passed that bill, actually, they could easily cancel any of our decisions. You make a decision and then they disqualify it. And it happened more than once in some committee in the Knesset. Now, this right to criticize the decisions of the government still exists. But that empowered the force of the government, and it empowered the possibility to make decisions quickly. You don't need millions of ministers. It's much quicker. And it also gives us the possibility to make urgent decisions in urgent matters in a much quicker way. And that's why we had to do certain activities in order to streamline the whole process of decision making, and also in order to avoid turning them over and then people come and claim against us. Why? Why did it happen? Because of the populism. Because it's so easy always to turn over a decision that is something we try to avoid. As Professor Gamzo said, we try to avoid restrictions. But here and there are restrictions. Maybe there'll be more. What are the restrictions? There'll always be somebody who will gain from saying, let's not do restrictions, and then the mobility goes up. I think we upgraded it, we streamlined it, and I think we'll act better. So I ask not just the public, but also the representatives of the public, please be responsible. Do things with responsibility. That's what you have to do now. You will not get out of me a date for a close down. I want to stop with this sport. What number of cases, how many severe people, how many ventilated, there'll be a lockdown. The most harsh decision of the government, and it will include a lot of consideration of the trend, of the medical system, the economy, the social. You will not get out a number out of me, but I'm telling you that it will be very, very, very responsible with a lot of consideration beforehand. Mr. Prime Minister, according to a poll we held today, 66% of the public are not happy with the way that you are managing the crisis. This important appointment is too late and too little. What about the sense of many people in the public that you and the government deal with personal issues and political issues instead of dealing only with the coronavirus, while we have such a rise of the morbidity and people lost their jobs? And also the announcement of this appointment came out in the middle of the night. Professor Barabash disagreed a minute before. Are you convinced that this is what it should be like? I'm a long time in politics, and I saw polls here and there going up and down. When we made at the time the big reforms that saved the country of Israel, the polls were not in favor of me. And also the real results were not real. But I got 12 seats according to the polls, and yet I did what I had to do. I told you at the time, we are in the ball court. The others are sitting in the dress circle. Yes, they shoot arrows and they click things in the computer. Okay, so it changes the polls, but I never acted according to the polls. In the real things that have to do with Israel's security or our national existence, our national security. We had the Iranian threat or an economic breakdown as it was in 2008, and I do the things that I believe that are needed for the security of Israel and the life of the citizens. And I'm going to continue this way. Therefore, this carousel, up and down, very nice. I'm going to do what I think is needed in order to ensure the lives of the people of Israel and their livelihood.
Professor
Barabash is my mentor. But the difference is that I left this ministry 5 years ago. I don't have a problem of authority. I don't have a problem to operate and work with Chezi or the minister. And in the last 24 hours, I saw that every authority I wanted, I got, because everybody really wants to upgrade and to improve and to do their job in the best way possible. So really, there's no problem of authority at all, including a lot of ministers and director generals in the government. I don't think there's any problem whatsoever. Mr. Prime Minister, in the last week, the state of Israel had some 60 people who died. And the businesses say they are not the sources for infections. Also, the religious institution, everybody says that they're not the source of infections. And yet, people are dying in Israel. What stopped, at the end of the day, the spread of the virus in the first wave was a complete lockdown. Maybe because of political considerations, the state of Israel today is not going towards a lockdown and actually prevents the continuation of not for political reasons, because of the economy. We saw what happened, the blow that the lockdown gave the economy. I spoke to the Prime Minister of Australia, and he says we also have this tension, the dilemma between health and life, because at the end of the day, if the severe cases are going to be on the rise, and Professor Gamzu said the same, you start to have a problem in dealing with them. You have a problem, you know, the staff in the hospitals, they're too loaded. And then you cannot deal with those severe cases. So then the chances are that they will die on a daily basis. And therefore you're here between two poles. One, you don't want to destroy the livelihood, and the second, that you don't want to make disastrous conditions here for people. And that's exactly why Ronnie is here with us. He gave us the recommendation, and believe me that we will not be deterred from making the right decision at the right time. I suggest give him a day or two to just settle down and see what's going on. Allow him to work, and he's working, and we will do the job the way it should be done. Mr. Prime Minister, today we heard that in the northern border, IDF reinforces itself, and also in Syria. Is Israel afraid from the reaction of the Hezbollah? Is there such a possibility? And also a question to Professor Gamzu. Who exactly are you subject to? Are you subject to the Prime Minister or to the Minister of Health? Can you give us an answer? And another question, what's the deadline regarding establishing a system of tests and detecting people who should be quarantined? We keep acting all the time against the attempts of Iran to base itself in Syria. It's no secret, you know all about it. We are acting diligently, constantly for quite a few years. This is the goal I spoke about. I said there are a few goals. The nuclear threat is number one. It was and still is. The second one is accurate missiles, and the third threat is attempts of Iranian basing itself and forging itself in Syria. I said we shall act against each of these threats, and that's what we're doing. We're completely determined to continue with this, and we are ready for any scenario. I wouldn't like to add anything. You asked something else, didn't you? To Professor Gamzu, okay?
סוריה, לא חיזבאללה, נכון?
Syria, not Hezbollah.
אני כפוף אליו.
I'm subject to him. He's subject to him, and he's subject to him. This is the order. There's no problem. We're working together. We have a joint mission. In my mind, there's no problem whatsoever. There's no complexity. We have mutual respect, mutual understanding. Chezi used to be subject to me. Now I'm subject to him. There's no problem at all here. I don't see any problem. And when it comes up, if it does, then we'll be able to arrange it among us, because there's no tension. And the second question was, what was it? Your deadline. When will you decide on a lockdown? Normally, it's a great question, but I think next week we're going to have quite an improvement. You know, already in the tests, we are now in 25,000, 30,000. It's not just a number, it's the preference. We have to improve the investigation, epidemiological system, and during the week I will be a briefing to all the journalists and we'll give you all the data that you need. Mr. Prime Minister, your partner, Benny Gantz, why isn't he not here? Is he not part of the struggle against the coronavirus? And also a question to Professor Virus, what is the first step and the most urgent, as far as you're concerned, in the battle? We are working in cooperation, so I hope, and I hope we will work in collaboration. You don't need to burden everything we do. One of the most difficult things in the state of Israel is there's too many procedures, too much red tape, too much legal aspects, and it really makes it very difficult. Therefore, now we're acting quickly, with complete knowledge, of course, of Benny Gantz. I think you spoke to him, didn't you? And he knows exactly about the appointment. He offered his help, and it's good. We'll need his help to mobilize the IDF in these efforts, because we want to deepen the IDF involvement. That's one thing, and I think that the most important thing is actually to act quickly and in collaboration, as you heard about this evening. I hope we'll do it in the future as well, throughout the way, because the state at the moment doesn't want to see elections, no politics. It wants to see real mobilization. Now we created the tools in the last few days, and I hope we shall use them. I plan to use them for the benefit of the citizens of this country. There are many steps that are first step. And if I have to select one, it's to improve the connection between tests and investigations. Of course, quarantines. These are steps that can be done even in the next few days. I learned it today. I know what has to be done, and I'm going to sit tomorrow on a lot of missions in this context. And this is the first thing I want to correct. Ynet is asking. First question, Prime Minister, we spoke all the time about the authorities. Can you explain to the public what's the difference between the authorities? We have the Council for Security. We have the Director General of the Minister of Health and others. Why do we need another one? It's more bureaucracy. And what are the differences? Why is this improving the situation? And I also wanted to ask Professor Gamzu, what about working with the IDF? What, more people, more cases are going to go to the hotels now, or what? What's going to happen? You have to understand that there are two missions here. One mission is to flatten the curve. It's rising to the top. We have to lower it. Once you lower it, you want to come to a long-term opening of the economy, of education, and the routine. In order to do that, you have to know how to cut the virus when it comes back, with restrictions, even maybe perhaps lockdown. When we lower it, it can come back. That's what's happening in many places in the world. Because the virus doesn't go home yet until they find a vaccine. It's here. And when you reduce the rate of infections, it's going to come back. You want to contain it, to stop it with a water breaker. Like you have a tsunami, you want a breaker of 5 meters. This breaker is the mechanism that Professor Gamzu is in charge of. We're in collaboration with the Ministry of Health and many other factors. What is this mechanism? This mechanism comes, first of all, to do the tests. Do you feel that you have a problem? You have a system of labs in the Ministry of Health, in the hospitals, in the HMOs, and there's a whole slew of places you can check, and all these tests you have to do how to integrate, to synchronize the information, and this you have to transfer to a system of epidemiological investigations, because what you want to do, you have to check who were they in contact with. This is the system of the investigations, as we call it. You have to do it quickly, and then from these investigations you have to make a decision who goes to quarantine. The same person, but everybody else that he had in contact in the first circle, let's say, of people who might be infected. These are 3 very complex information systems. Somebody has to contain all of them, to envelop all these 3 systems in one information system. It's not perfect in any country, by the way. It's not perfect in any country. There's no such thing. Perfect information, but you have efficient information. What Roni is required to do now, in collaboration with the Ministry of Health and IDF and many other factors, is actually to combine these 3 factors to one good machine. And this is a very difficult mission. You can say, okay, I have people who are in charge in the hospitals. I have people who are in charge in the HMOs for the tests. I have people who live whatever, they're in charge of quarantines. Yes, there are a lot of people, but you have to take all these 3 large systems and to give them one director, one person in charge, and this is Roni. How does it work? It does work. There's a lot of work that has been done already. We did a lot of things. You must, at the moment, we're almost first in the world in the number of tests, but the integration of the information is very, very difficult. It's not simple. This is a process that are in stages, and I think Roni will accelerate it. By the way, you have to understand, all over the world, especially in democracies, treating corona, we haven't seen it in the whole century. This is trial and error. You make an error and you correct it. You do something, you correct, you improve. It's true also for the decision-making process during Corona. Because you think these are regular days, what? The Knesset can make decisions and have long deliberations, and the government will go through all of the ministers. Everybody will have the right to speak and to appeal, whatever. We don't have time. We don't have time. We have to act differently. Inter alia, we need this project manager, and that's what he does. Before anything else, he takes these 3 systems, tests, investigations, quarantine, and he connects them into one format, and we're all going to help you. This is a great surprise, but all of us will help him. Professor Gamzu. I didn't study this issue. If you talk about the home front, I'll study it in the next few days, and then I'll have an opinion